This is Namitha Seth for NEJM Catalyst. Today, I am speaking with Dr. Catherine Hochman, Division Director, Hospital Medicine, and Associate Chair, Quality of Care in the Department of Medicine at NYU Langone Health. Dr. Hochman has created community across the health system over the last 10 years by leaning into what most of us love to do, and that is read. The Patient Experience Book Club is open to all members of the NYU Langone Health community. Employees engage with each other through shared reading experiences that explore the patient's point of view in a variety of healthcare situations and settings. What started informally now 13 years ago has become an integral part of the institution, with the milestone of, as of this year, having read a total of 100 books. I invited Dr. Hochman to speak with us today because I believe in the power of books and in the power of shared experience to build team and community. But also, I believe in the ability to demonstrate that innovation and creativity can also be simple. In the current environment, we often end up talking about technology or AI or things that require exorbitant investments and resources. And sometimes it's just about people in a room talking about a book. Kathy, thank you so much for speaking with NEJM Catalyst today.
Thank you so much, Namitha. It's a thrill to be here.
No pun intended, but let's start at the beginning of the story. Why did you start the Patient Experience Book Club?
It's funny you asked that because I can pinpoint the very, very beginning. I attended a meeting on how to improve the patient experience way back in 2011. And the key takeaway for me from that conference was that in order to improve the patient experience, we first have to address the experience of the faculty and staff. At a time when patients have like shorter and shorter lengths of stay and have more and more comorbidities, how do we make work more joyful? So then my next question was, all right, with no funding, how can we build something meaningful and sustainable? And then my mind really raced to books. They're cheap, they're very accessible, and of course, they're very enjoyable. So that's how the NYU Langone Patient Experience Book Club was born.
Most of us are familiar with book clubs, at least the kind where you go and you eat and chat and laugh with your friends. Then maybe you talk about the book for 10 minutes
Right.
and it's time to go home. Tell me what happens at your book clubs, and more specifically, how do you honor that theme of patient experience?
Great question. So our goal really is to build community and empathy. Don't get me wrong, we laugh, we eat, we chat, we enjoy ourselves, but while we discuss the book, we don't really take ourselves too seriously, but we are very serious about our discussions. So we read 12 books a year. We offer 2 sessions per month, one of them virtual for the people who are all over our health system and one for the people who could meet over lunch. And then we start each session with introductions because we want to create community. There are people in our book club who I would probably have never met. So we lay the foundation that this is a safe place to talk. And then we really dive into like a 45-minute discussion. And usually I have notes, but usually I don't even look at the notes because the group goes where the group goes. At about the 10 minutes to the hour mark, I ask the question, okay, how, if at all, has this book changed the way we practice our medicine or simply how we interact with our coworkers? It's very powerful. And every session I think is left, we have some meaning. And in fact, we had a really great book. This last book we read, it was called Wonder Drug by Jennifer Vanderbeest. Amazing, wonderful, very well researched history about the horrors of thalidomide. How
Mm.
the drug was just so poorly researched and then widely distributed, both in Europe and the United States. And it really led us to a very interesting and important discussion of true informed consent. So we try to bring every single book back to the patient experience.
You shared this recent, what sounds like very rich discussion. Are there other poignant insights from discussions that you've had? And help me understand how you manage to have what I imagine are very deeply personal conversations while also respecting professional boundaries.
We've gotten to really know each other over the years. And as I mentioned before, I start every discussion with a mention that sometimes people share something personal and it must never leave the room or the Zoom room. And
Mm.
people really very much trust that. We've read some really deep books. In fact, I always say, we don't read, there's no beach reads in our book club. But just as an example, we read Genderqueer last year. And, each book draws on a different audience. We do fiction, nonfiction, we have graphic novels, we have short stories. So there was a particular member who came to the session who doesn't really join many of the sessions. And she said something that I'll never forget. She said that this book helped her feel very supported amongst her community, and that she was better able to understand her child's views, and that she was really proud to be in an institution that that supported her and her values. That's just sort of the tip of the iceberg. We've read books upon Tanya Frank's Zigzag Boy talks about schizophrenia and the troubles of one mother who was trying to live her life and also tend to her son's needs. So that was very poignant. And other people mentioned family members with similar struggles. And things that we sometimes don't talk much about, like postpartum depression. We have great discussions about poverty, health, bias, and how all this impacts health. The undervalued role of a caregiver has been a theme,
Mm.
as well as other short stories all about the human condition.
It sounds like you create an environment where the attendees can bring their whole selves to the conversation and create a safe space to bring themselves into the room, into the discussion. How do you know how to do that? You're facilitating these difficult conversations with people who may not know each other very well. How did you learn to do that?
I think a lot of it was trial and error, and also making myself vulnerable.
Mhm.
There are stories that I've shared that are very personal, and to say that it's okay that I had doubts and misgivings, or I didn't like a character, or it was okay not to love a book, and just I think just to sort of my model as a leader is to be very authentic, and so I bring that to the book club. And I hope that that sort of resonates with the readership and the membership. So I think a lot of it was trial and error. There have been some great sessions and there have been some sessions that haven't been so good. But again, now that we've done 100 books, we've gotten pretty good at it.
Well, I appreciate your authenticity and your vulnerability because it is a learning process. Uh, and we kind of want to know about logistics. Tell me about how the book club works. Who picks the books? Who funds this? How do you schedule?
Absolutely. So we've gotten really big. And now that we have over 400 people on our listserv, now not everybody comes to every session, obviously, but I thought that it was important that it wasn't just me picking the books. In the early days, it was like, oh, what did I love to read? And that's what we read. But now I've created like a mini committee of two really intense bibliophiles, and I want to give them a shout out, Dilshad Marolia and Roger Smith. So they're part of the executive book club committee. And every October, it's one of my favorite meetings of the year, we sit down and we review the recommendations of all the people who have submitted what they think is a great read. So
Mm.
we'll go through it. Sometimes we'll read the book, sometimes we'll just leaf through it. And we'll pick the books for the year. So that's the logistics. Thankfully, we have administrative support to make the meetings and the lunches. And most importantly, over these past couple of years, we've had tremendous support from the auxiliary of NYU Langone Health. We didn't always have the support, but they are such fantastic partners. So they will provide support for things like the food. We're sending somebody to a conference this year to talk about our book club. And we have special, when the dean comes and wants to talk about his favorite book, we had a pop-up meeting. So so they've created support for things like that. It's been terrific.
How, and I have to ask this, do you track metrics of success? What do you track so that if nothing else, you can continue to ensure funding? And specifically, do you have to quote unquote prove that this somehow impacts patient care in a positive way?
The holy grail is an improvement of our HCAP scores. Um, but what we measure also is survey results from our readership. Now, there is such a thing as survey bias, so I'm going to say that out loud. But we have polled the group and we ask things like, does the book club align with the mission of NYU Langone Health?
Mm.
And there'll be, four answers. My participation with the book club makes me feel more engaged with the institution. My participation with the book club increases my overall sense of professional well-being, things like this. And our results are really off the charts. People who are in the club who, and most of them have responded to the survey, really do feel that the book club has improved their sense of well-being and belonging in our institution, which makes me very proud.
Yes. And I'm not going to use our precious minutes digging into the limitations of surveys and who chooses to answer them.
Absolutely.
Leave it at sometimes a good book can be enough. Sometimes a good conversation can be.
Absolutely.
Now, that
Absolutely.
being said, this is a lot of work, and I imagine there have been some challenges, over the last 13 years. What have been some of those challenges in sustaining this effort, and how have you overcome them?
The biggest challenge was COVID. We weren't sure, especially in New York City with everything happening in the early parts of 2020, if people had space to read with everything else that was going on in life.
Mm.
Guess what? We were absolutely wrong about that. And in fact, our the importance of the book club was really intensified. We weren't able to, of course, meet in person, but guess what? There wasn't really much else for people to be doing in terms of entertainment. So we went from 6 books a year up to 12 books a year. We went from one monthly session to two monthly sessions. And it really showed me that people craved connection more than ever. Our membership exploded. And that's when I think, at least in New York City, we really started appreciating the special community that we were building. So I thought it was going to be a huge challenge, but it ended up being a way to really intensify our connections with one another.
How about in more recent years? What are some of the more mundane daily challenges that if someone else at another institution were to kick something like this off, they'd have to pay attention to? What are
I
anticipated
yeah.
goals?
So I think, it's always hardest to get going. It's always hardest to start. But I want to mention that this is a very portable initiative. Like
Mm.
anything, and like any initiative, you really need a champion, someone who knows they're going to get this done no matter what. I would start with not 12 books a year for 2 sessions, but start with 4 books a year over lunch, just one session a month, maybe. Create a modest budget, because that had been, to answer your question, our earlier challenges to try to meet the needs for our membership. Start with a modest budget, present it to your CMO, and hook the CMO with the goal that we want to build community and empathy to better understand the patient experience. What CMO would not want that? And it's fair, and it's fairly cheap. And guess what? You can ask your CMO to kick off a session with his or her favorite book. And that's a great way to bring sort of a stakeholder into your book club immediately. Other places of funding, your patient experience office, perhaps, or for us, it was our auxiliary. And then don't forget word of mouth. Word of mouth is the most powerful, but advertise with your HR department or the wellness section of your website. These are all great ways to get the word out. And when you finish a book club, one of the things we always do is we make sure to take a photo, even if it's on Zoom. We take a screenshot of us in the Zoom room, and I always write a wrap-up email to include the people who couldn't make it. Like, this was the gist of our discussion, and we look forward to the next book. So these are ways. It's hardest to get started, but then it builds, and it's very, very portable and very doable.
I appreciate both your overall mission as to your why that you do this, and applaud you on the community that you have and are building, and also really appreciate the tactical advice that you're giving our listeners today.
My
And
pleasure.
for our last question, and not to put you on the spot, but what has been your favorite book of 2025 so far?
Favorite is a very hard word, but if you're putting me on the spot, I'm going to say The Autumn Ghost by Dr. Hannah Wunsch. This is an amazingly researched book on the polio epidemic in Holland in 1952. The really interesting part for me was how polio in Holland really triggered the beginnings of critical care and positive pressure ventilation. So
Hmm.
when we go to the ICUs, it all the stuff that we take for granted, the vents and everything, They came from the necessity of needing to ventilate all these poor people who had polio in Holland. And in the United States, we had the iron lung. That was negative pressure. But in Holland, they went to the positive pressure, where the medical students, and this was a great part about the book, legions of medical students came to basically, they were thrown into caring for these polio patients by pumping bags full of air 24/7. So you can imagine being this like first year medical student and trying to keep people alive. It was a really well researched book. And again, of all the books, I think, and Dr. Wunsch came to actually personally come to give to one of our book club sessions, which made it extra special.
Oh my goodness, indeed. Well, I look forward to going to the website, which is included on our website, that lists all the books. And we appreciate your openness and willingness to share and build community even more broadly across NEJM Catalyst. Thank you so much for joining us today, Kathy.
My pleasure. Thank you so much, Namatha.